Gallstone lithiasis, symptoms, cause, composition, treatments. Do you feel a sharp pain in the right side of the abdomen after meals? You may be suffering from the presence of stones in your gallbladder. What are the symptoms? The causes? Treatments to ease the pain? Answers from Professor Robert Benamouzig, specialist in gastroenterology. Gallstones, also called cholelithiasis, are small pebbles that form in the bile ducts gallbladder. Sudden pain then appears in the pit of the stomach or under the ribs. The pain may radiate to the shoulder and be accompanied by nausea and fever. What are the causes of gallstones? What are the treatments? When to consult? Is an operation always necessary? Point. Definition. What is a gallstone? A gallstone is a more or less large mass of crystals, pebbles present in the gallbladder or the bile ducts. In general, the gallstone is composed of cholesterol, bilirubin, but it can also come from calcium salts. The formation of gallstones is favored by pregnancy, obesity and diabetes. Most of the time, they are painless and asymptomatic. Sometimes, however, they cause very painful hepatic colic, relieved by the evacuation of the calculation responsible. The gallbladder is a small pocket located under the liver, responsible for storing bile, a substance produced by the liver. The gallbladder is connected to the liver, pancreas and small intestine by different channels, see diagram below. During digestion, the gallbladder contracts and pours bile into the small intestine to promote proper digestion. Bile is made up of water, cholesterol, mineral salts and bile pigments, called bilirubin. If the bile has too high a concentration of cholesterol or bilirubin, stones whose size can vary enormously, can form in the gallbladder. These are the ones that are painful. What is the composition of a gallstone? A gallstone is a small pebble made up of cholesterol, bilirubin, calcium, mucines, protein. There are two types of gallstones. Cholesterol stones composed only of cholesterol, when they are pure, and of cholesterol and bile pigments when they are mixed. Pigmentary stones composed of polymers of bilirubin salts, black stones, or sodium bilirubinate brown stones. What are the symptoms of a gallstone? The most characteristic symptom is a sharp pain, felt most often after a rich meal, which is sometimes accompanied by nausea. Affected individuals may also experience pain in the right shoulder, because neurological interactions exist with the gallbladder. Fever. If the pain is accompanied by fever and intensifies with movement and breathing, it may be cholecystitis. Chronic or acute cholecystitis. What are the signs? Cholecystitis is an inflammation of the gallbladder. What are its symptoms? Its causes? Its possible complications? His treatments? From the age of 50, it is common to have one or more stones in the gallbladder, but most of them are very small and cause no symptoms. What are the causes of a gallstone? First of all, it is important to distinguish pain in the right hypochondrium, the region of the gallbladder, from pain in the gallbladder itself, immediately warns Professor Robert Benamouzig, specialist in gastroenterology at the Avicenne Hospital of Bobigny APHP. And to add, indeed, the pains of the right hypochondrium do not necessarily come from the gallbladder. They can in particular be due to spasms, hepatic pathologies, or an anomaly of the bile ducts. One of the most common causes of pain is the appearance of small pebbles in the gallbladder. We speak of vesicular lithiasis. These gallstones can slow down the flow of bile, or even completely obstruct the channel that it must take to reach the intestine, which causes severe pain, hepatic colic. An infectious pathology of the gallbladder, such as cholecystitis, can also cause this pain. Cholecystitis is inflammation of the gallbladder wall. When to consult? Pain in this area does not necessarily warrant a medical consultation. In most cases, it is pain in the right hypochondrium, specifies Professor Benamouzig. But if the pain is really very intense, if it is repeated, you must consult to identify the precise cause of the discomfort. And if the pain is accompanied by fever, it is a medical emergency. An ultrasound is thus performed to determine the origin of the problem. What treatments to relieve gallstones? Medications. While gallstones often resolve on their own, drug treatment, based on ursodeoxycholic acid, a major component of bare bile, is sometimes necessary to get rid of them. People prone to this type of calculations must also review their diet, in particular by eliminating foods that are too fatty. Gallbladder removal. In some cases, removal of the gallbladder, called a cholecystectomy, is necessary, especially if the stones are too painful and threaten the pancreas. It is a very common operation practiced on nearly 100,000 people each year in France. It is therefore quite possible to live without a gallbladder. The bile then flows directly from the liver to the small intestine.